I would like to invite Dr. Jose Kochuparambil, who is the Chief Quality Officer and Clinical Pharmacy Advisor at MedJury. Welcome, sir.
Hello everyone, myself Jose Kochuparambil, and I am here to present to you regarding the role of clinical pharmacist in patient care. I thank Kaho, Esqua and Ruby Hall Clinic for this opportunity. I started my career as a clinical pharmacist. I've been trained and educated to work as a clinical pharmacist, but right now I am working as an administrative role. Moving into clinical pharmacy and starting with the definition of clinical pharmacy. Clinical pharmacy is a health science discipline embracing pharmaceutical care principles in which the pharmacist is a key player. A pharmacist optimizes medication therapy, promotes health and diseases based on his therapeutic knowledge. The main aim of clinical pharmacy is to promote the rational use of medicines. In India, clinical pharmacy is a new concept and it was introduced almost 10 years back with the introduction of doctor pharmacy program in the year 2008. Some of you may wonder how a clinical pharmacy is different from hospital pharmacy. In hospital pharmacy, the main focus is on drugs and the pharmacist will be limited to the 4 walls of the pharmacy. Whereas in clinical pharmacy, the focus shifts from a single drug or a combination of drugs to the patient who is taking the medicine. And there will be a patient-centric approach and the drugs will be prescribed based on that and the clinical pharmacist will be aiding this process. So the clinical pharmacy deals with the overall therapy management. Who is a clinical pharmacist? The qualification of a clinical pharmacist is defined by the Pharmacy Council of India, which is a statutory body that is under the Ministry of Health and Family Welfare. A clinical pharmacist can either be a PharmD graduate who have completed 6 years doctor pharmacy program, or a PharmD PB graduate who have completed a 3 years program after BPharm, or the one who have completed MPharm pharmacy practice. What is the defined role of a clinical pharmacist? There is, in India, the role of a clinical pharmacist is not well defined. Based on my understanding and my experience, I would like to tell that the role of a clinical pharmacist is defined by 2 factors. First is the need of a hospital, and the second is talent and skill of the clinical pharmacist. Need of a hospital can be varied. It can be varied from size of the hospital, the scope of service of the hospital. And if the hospital is looking for an accreditation, the role of a clinical pharmacist may vary. And if the hospital is willing to promote patients, he should have a vast knowledge regarding the pathophysiology of the disease along with the pharmacotherapy and non-pharmacological management. He should have a good communication skill and should use the logical reasoning and critical thinking to make the drugs or choose the drugs that are well suited for the patient. The role of a clinical pharmacist can be divided into 3 domains: a clinical domain, administrative domain, and a research domain. And in the clinical domain, it can be further divided into inpatient care and ambulatory care. The role of a clinical pharmacist in inpatient care is provided in accordance with the medication-related policies and formulary parameters within the organization. A role of a clinical pharmacist begins when the patient is admitted and he has a role till the patient is discharged. At the time of admission of the patient, the clinical pharmacist documents the medical and medication history of the patient. He will document the past history, the comorbid conditions, the medication history, family history, social history, and history of possible allergies. Probably a patient will be coming to a hospital with a handful of medicines, or like he will be carrying out his old prescription. A clinical pharmacist should approach the patient with a smile, and he have to recheck the patient's own medicines and verify them with the documented medication history. So an accurate medication history documentation have a very important role. It can prevent prescription errors and it can be useful in detecting potential drug-related problems, including drug interactions or drug disease interactions or drug food interactions. Like some of one question has been asked in the previous session. Some drug food interactions, or it can be like a vitamin K rich foods can interact with warfarin. So all this should be monitored, and if the patient is not following, is not adherent to the therapy, changes have to be made. And the clinical pharmacist, when doing an accurate medication history, it will help in a targeted drug therapy. If a patient have a clinical pharmacist can help in a targeted drug therapy. So what are the informations to be recorded? The informations regarding the medicines, the OTC medicines, vaccinations, alternative traditional medicines, and regarding the description of any past allergies or ADRs. During the patient care process, the clinical pharmacist should participate in ward rounds, and by doing this, he can prevent a lot of drug-related problems, including improper drug selection, untreated indications, overdose or underdose drug interactions, and ADRs. He can aid the prescriber in selecting the right prescription, right drug. He can do this with the help of information sources like journals, therapeutic guidelines, drug formulary, and the drug-related policies within the hospital, as well as the efficacy and safety data. Prior to prescription, he can do a lot of medicine that has been chosen. He can ensure that all the medicines are being prescribed. He can review the medication for cost effectiveness, can check the complete drug profile for any kind of drug-related problems like duplication, interactions, or incompatibilities. After the prescription, a clinical pharmacist have a role in prescription even monitoring. It is a safety evaluation process after marketing a drug. He can help the pharmaceutical company if in proving the drug is safe and efficacious, can conduct medication reconciliation in every point of transition of care, can evaluate the safety of treatment regimen and assess the progress of the disease and check for if any change therapy like a switchover or step down is necessary. He can provide drug information services and can provide some sort of patient counseling. At the time of discharge, he can help the prescriber with medication reconciliation and check for drug-related problems and provide counseling with the help of drug information or disease information materials. After discharge, a clinical pharmacist can involve in surveillance programs like SSI surveillance or ADR surveillance, and he can provide drug information services. In my hospital, we were conducting a drug information service that is based on WhatsApp, and we were getting more than 20 queries per day from discharged patients. And this was run by the clinical pharmacist department. The ambulatory care services include outpatient medication assessment programs, patient counseling, and the assisting or teaching regarding the medical devices, the use of medical devices. A clinical pharmacist can play a vital role in OPAT, outpatient parenteral antibiotic therapy. Moving into the second domain, the administrative role of a clinical pharmacist. A clinical pharmacist can play a vital role in implementing quality improvement projects, clinical audits. He has a major role in hospital committees as well as in accreditation and training and development. In quality improvement programs, a clinical pharmacist have a major role, and this is not limited to the pharmacy or clinical pharmacy department. He can explore every department in the hospital, and he can start his career as a quality executive. A pharma graduate can start his career as a quality executive, and with the clinical knowledge as well as a skill for administration, he can excel in this domain. The person can perform clinical audits as well as prescription dispensing audit and medical record audit to describe the quality of prescribed service in the hospital. And this can give a lot of input regarding the prescribing practices in the hospital, and if there is any sort of recurring errors, this can be an eye-opener. Moving to the roles in hospital committees. A clinical pharmacist in Pharmacy and Therapeutics Committee can act as a convener with a great knowledge regarding therapeutics. He can act as an ID pharmacist if he is specialized in infectious diseases, can coordinate the hospital infection control committee and work with the team to develop antimicrobial stewardship plan and antibiotic policies. A clinical pharmacist can coordinate the medication safety committee and can support the use of high-risk medications, can oversight the standardized procedures like use of medication administration devices, use of automation and maintenance of high alert list. The clinical pharmacist can help in developing guidelines and self-assessment tools to evaluate the safety practices within the pharmacy. A competent clinical pharmacist with knowledge as well as skill can serve as a medication safety officer. I'm clinical pharmacist as a researcher. Research methodology and biostatistics is a part of the clinical pharmacy curriculum, that is the Doctor of Pharmacy and MPharm curriculum. So he can be a part of a research programs as well. He can coordinate with the pharmacy department, clinical pharmacy department, and other disciplines to conduct researches as well as pharmaceutical industry sponsored research within the hospital. The research can be divided 4 domains, 4 segments. The first one is pharmaceutical research, including the testing of drug dosage forms and drug preparations. The second one is clinical research to assess the outcome of drug therapy and drug treatment regimens. The third one is in health service research and development, that includes pharmacoeconomic research. The fourth one is operational research, and this involves the evaluation of programs and services within pharmacy department and other domains. Thank you.